Welcome to the first session of our quality improvement program for the PHN. And the first session today is on closing the gap. My name is Karen Thew. I am one of the First Nations Health Access Officers here on the Central Coast on Darkinjung land. I will now be starting the presentation. I will start by acknowledging and pay my respects to the elders past, present, as the traditional caretakers of the lands on which we are working on today, and any First Nations participants joining this webinar. I recognise and celebrate the diversity of First Nations people and ongoing culture to the lands and water. This is our First Nations team here for the Hunter, New England and Central Coast. This is our footprint of the regions of where we actually, the PHN support, and we travel to the top of Tenterfield all the way down here to the coast. So the learning outcomes for today is our aim is for you to understand the objectives and significance of closing the gap and to identify historical events and policies that have impacted the health of First Nations people and to develop skills and knowledge to support First Nations people within your practice. So closing the gap 2008 to 2016. In 2016, the Council of Australian Government introduced a refresh of the initiative, as First Nations leaders welcomed a refresh to closing the gap. While some First Nations people could provide input on the policy and its programs, full ownership by First Nations representatives was not achieved, and the initiative remained a government-driven effort. Implementation of closing the gap was inconsistent with partial progress in some of the targets, and some targets are at a standstill. Government collaboration diminished, and long-term funding for programs was uncertain, and there was no sustained effort to include communities in decisions about achieving targets. So what is closing the gap? It's a commitment from the government to achieve equality for First Nations health and life expectancy. This is the story of a collective journey and a shared commitment to empower people to live healthy and prosperous lives. I will now play you a short video.
The story of our communities, people and nation starts a long, long time ago. More than 60,000 years, in fact. This was when our culture and our law first started to thrive. We knew who we were and where we belonged. We took care of each other, our land and our waters. We ate food that made us healthy, lived on country and abided by our laws and song lines. Our families, our children were happy, with strong minds and hearts, because they were where they belonged. But then, everything changed.
Colonization came, bringing wars, disease, famine, violence, and the destruction and violation of our cultural laws, sacred sites, families, and communities.
We were denied our knowledge, language, ceremonies, and identity. The very things that tell us who we are and where we belong. And our connections with each other and the land grew weak.
And then, our children were taken from us. They had their names changed and their identities stripped away. They were told that Aboriginal people were bad. Worse still, they were told that their parents and grandparents did not want them.
For years this happened, and those children became known as the Stolen Generations.
Our children were denied love and experienced physical, emotional, and sexual abuse. This left very deep, very complex, and very real wounds, leaving scars that are still being felt personally, socially, spiritually, and collectively.
In the time when our story started, we were able to parent in the cultural way that has seen our families survive and thrive for generations. Our people were strong, and our culture flowed and healed us in times of hurt.
But since the trauma of colonization and the stolen generations, we have not been able to heal in the same way. And we have unknowingly passed this trauma on to our children through sharing our sad stories and having them witness and experience our pain. This is known as intergenerational trauma, and we see symptoms today in broken relationships, disconnected families, violence, suicide, and drug and alcohol abuse.
But this is not where our story ends. We still have strong minds and hearts, and we still know who we were and where we belong. By creating safe and strong communities together, supporting our families to be free from pain, returning to our culture and building a strength of identity, we can stop the cycle of trauma and bring about positive intergenerational change so that we can continue to thrive for the next 60,000 years. There are simple things that we can all do to help heal our trauma.
Visit healingfoundation.org.au to
Closing the gap and how it started. So 2007, the Australian government's committed to closing the gap in the life expectancy between First Nations and non-First Nations people. In 2008, an apology from Kevin Rudd added 6 more targets to the initiative. And in 2009, a commitment for annual progress report to Parliament. In 2020, a framework and strategy was overhauled and a greater focus on partnerships between governments and First Nations people. So the impacts on First Nations health. First Nations people may struggle with their sense of identity and feel fear or shame discussing their health concerns openly with non-First Nations people, especially when these individuals have experienced judgment or racism. And the underlying cause of the poor First Nations health is multifaceted, and it includes social and economic exclusion, unemployment, low income, inadequate housing and sanitation, limited education, and insufficient nutrition. Discussing their health concerns openly with non Indigenous people is one of the concerns for our First Nations people to make them feel culturally safe. Additionally, high rates of depression, anxiety, and PTSD, suicide, and chronic disease conditions contribute to health disparities. First Nations people often face significant barriers to accessing private specialist and allied health services in which stem from a lack of awareness of available services within mainstream primary care. First Nations people are disproportionately represented in the justice system. This overrepresentation reflects systemic issues and historical injustices. Historically, First Nations people have had limited power to influence the factors affecting their health. Public policy decisions have often neglected their needs, resulting in insufficient resources and inadequate support. So, what is being done differently? So, acknowledging that to close the gap, First Nations people must determine, drive, and own the desired outcomes alongside all governments. They're about transforming the way governments work with First Nations people to improve outcomes. The priority reforms were supported during community engagement. There are now 17 targets to close the gap to achieve outcomes from 2020 to 2031. They set out how policy and programs are aligned to the national agreement and what actions will be taken to achieve the priority reforms and outcomes. So the closing the gap targets. So number one is the life expectancy within a generation. So governments need to share power to make meaningful progress. Indigenous data sovereignty must be recognised and supported, and mainstream systems and cultures with government should be fundamental rethought, and stronger accountability is required to drive behaviour change. Children are born healthy and strong. A higher proportion of First Nation babies are being born at a healthy birth weight, and the target is on track to be met by 2021. Target 3. Childhood education is high quality and culturally appropriate in the early years. The proportion of First Nations children enrolled in year before full-time schooling, early childhood education is increasing and on track to be met by 2025. Children thrive in their early years, target 4. The proportion of First Nations children assessed as developmentally on track has declined, and the target is not on track to be met by 2031. Target 5. Students achieve their full learning potential. The proportion of Aboriginal and Torres Strait Islander people attaining Year 12 or equivalent is increasing, but the target is not on track to be met by 2031. So students reach their full potential through further education is target 6. The proportion of First Nations people aged 25 to 34 years who have completed a tertiary qualification is increasing, but the target is not on track to be met by 2031. Youth are engaged in employment or education. So the proportion of First Nations young people fully engaged in employment, education or training has increased, but the target is not on track to be met by 2031. Target 8, strong economic participation and development of people and their communities. There's been an improvement in the proportion of First Nations people aged 25 to 64 who are employed, and the target is on track to be met by 2031. Target 9. People can secure appropriate, affordable housing that is aligned with their priorities and needs. There has been an increase in the proportion of First Nations people living in appropriately sized, not overcrowded housing, but this target is not on track to be met by 2031. Slide 10, adults are not overrepresented in the criminal justice system. First Nations adults are being incarcerated at an increased rate. and the target of a 15% reduction by 2031 is not on track to be met. Number 11, young people are not overrepresented in the criminal justice system. The rate of First Nations children in out-of-home care is increasing, not decreasing. So the First Nations young people continue to be overrepresented in the criminal justice system. So children is not overrepresented. So in the children in and out of home care is increasing, and it's not actually decreasing, it's increasing, and the target is not on track to be met by 2031. Families and households are safe. All forms of abuse against First Nations women and children is to be reduced by 50% by 2031. We have no reports on the data to upgrade this. People enjoy high levels of social and emotional well-being. First Nations people, the rate of deaths by suicide is increasing, and the target of a significant and sustained reduction is not on track to meet by 2031. Target 15. People maintain a distinctive cultural, spiritual, physical and economic relationship with their lands and waters. The proportion of land mass subject to First Nations people's legal rights or interests is increasing and on track to be met by 2031. The proportion of sea area covered by First Nations people's rights or interests is also increasing and is on track to be met by potentially exceeded by 2030. Target 16. Cultures and languages are strong, supported and flourishing. There is no data to support any progress towards First Nations languages since the baseline was established in 2008. 17. People have access to information and services enabling participation in informed decision making regarding their own lives. There is still a work in progress, and there's still no data on this target number 17 as well. So there's no data to report any changes. Here's some references and citations we've used in this presentation. Please feel free to have a look at any of these. So what can your practice do to achieve outcomes, help to achieve outcomes for our First Nations people? So these are the 7 of our program for quality improvement within practices that you can help us with. And we really appreciate it. Health Pathways is an introduction on how to navigate health pathways, which has all the specific populations arrow. It has your search button up the top, and it has a lot of information on closing the gap, 715 health assessments. It's got all of these 7 quality improvement are all on this health pathways. So please feel free to take a look at this website. If you don't have any login details or anything for this website, please don't hesitate to contact myself. So after today's session, there's a survey we'd like you to complete after each of our education sessions, which would be beneficial for us. And there's also a First Nations website for the PHN, and we have a lot of resources. So if you want to visit our website, the link is on the page there, and we have a lot of fact sheets for all of these presentations that can be printable as well. And I would like to thank you, and the First Nations team would like to thank you all for participating in our quality improvement program. Thank you.